Hi, Dr. Vicent. So glad to invite you to talk about Alliedstar intraoral scanner and also to talk about your insights on the intraoral scanner. So firstly, may I know how long have been used with Alliedstar intraoral scanner S100?
Yes, with 100 we have now 1 year approximately of using. We are very happy with the use. My staff is very happy because it's a very interesting intraoral scanner. We can compare, with many different scanners in our office, and we use this like a principal scanner for the facility. With the 100 we are very happy. It's so easy to use that for the staff it's crazy if you compare with another softwares. And with 200 unit, this is crazy when you use this scanner for the patient. The patient is seeing, it's watching in the TV what you're scanning, and you can do a very good communication with the patient. And with our staff the same. You can use in different rooms, and it's very versatile and very interesting. So we love this machine for the facility. Okay?
Yeah, thank you. And may I know what are the majority clinical cases you have tried with the scanner, and how is the fit rate?
For us, maybe 70% it's around implant works. Okay, we only use in digital. We work in digital. And for us, the 70% it's around works in implants. Maybe the big goal for us is in a full arch cases. Okay, this is maybe one of the most important uses in our office, and this 30% around works in not just say dentistry, but yes, dental bridges, dental crowns, veneers. Okay, with fixed dental prosthesis and in aligners. And aligners, and we use also for digital ortho trainers with braces. Okay, the same. We use for ortho, for prosthesis, and one of the most important goals, we use both scanners in the first visit. Okay, because it's so fast, and you can scan without many options. It's very fast, the scanning in both the scanners, and you can show to the patient in the first appointment the real situation. You can do a very good communication with the patient from the first step.
So how do you think the color performance of the scanner compared to other mainstream intraoral scanners on the market?
I think we are
color performance.
Thank you. We are now in a very good moment, in a very interesting moment of the color performance, because maybe not for us, maybe not for the designers, for the lab technicians. Maybe the most important is for the patient. The patient can see in a very realistic color and can understand perfectly which is the problem, the cavities, the size, the localization, and it's very interesting now in this moment to avoid a monocolor. Monocolor maybe it's more for the design, but now with the color it's crazy to improve the communication with the patients.
Regarding the patient engagement, we can see that on the market there are already many intraoral scanners configured with the patient engagement apps. For example, caries detections, smile design, also simulation, or other patient engagement apps like oral health reports and so on. So in your opinion, does these software apps really helps dentists on patient communication and increase the case acceptance?
I'm according with you. I think actually patients have a very easy possibilities to communicate, to understand everything in internet, in Google. They can Google absolutely all that you say in the first appointment, and they want a different dentist. Okay, I don't know in other countries. In Spain, we have around a little bit more than 30% of the office has an intraoral scanner, and this number is growing and growing and increasing. The patients now, all the patients has a digital technology, smartphones or something like this, digital smart glasses with digital apps, the same, and the tablets we are digitalized, And patients, for us, it's incredible to take an intraoral scanner and a wireless scanner. For the patients, it's normal. When we work with this, from the first appointment, it's very interesting to give a report, and to give some photographs you can capture with the software. You can take some captures. You can use like an intraoral camera. It's not necessary to use like an intraoral scanner. It's not only in a machine to take an intraoral impressions. You can use like a intraoral camera. You can take some pictures to show with more detail these cavities, for example, or these problems, the gum disease, all of these things. And I think that this is mandatory for the intraoral scanners. And apps like Digital Smile Design or something like this, or Model Creator and Model Simulator of the possibilities of ortho treatments or treatment simulators for veneers. All of these steps, every day we are including all of these apps in our daily practice. And for me, actually, I cannot come back. For example, for 6 months practice or one year. For me, it's crazy. Now we are including all of these reports for the patient, the simulator. You can work with a lot of systems of aligners, or for example, to do a smile design in the same moment, not exactly, not like the final, but very approximately to capture to the patient and to create an emotional moment with the patient to share this picture, or they can see in a simulation of the possibilities of the final treatment. And now we cannot come back to the past. Give me 2 weeks. I have to do some photographs, some steps, and a wax up, analogic wax up. No. Today, from the first day, in a second visit, and very near. It's not necessary to wait 1 or 2 weeks. Maybe in 1 day or in some hours we can do a second visit with a better design, and we can close these visits as soon as possible. It's not necessary to wait to the patient 1 or 2 weeks, like 1 or 2 or 3, 5 years ago.
Well, as a digital implantology expert and also smile design expert, you are very expertise on the intraoral scanner and also the digital workflow. So I was wondering, what have you seen on the difference on the intraoral scanner, the main difference on the intraoral scanners with good scanners and bad scanners, or the mainstream medium level scanners? What do you see the difference between the?
I'm a lucky guy because I try
a lot of different intraoral scanners.
Maybe I try more than 30-40 scanners actually, and we have not studies with all of this, but we have an analysis made by ourselves with different labs or different collaborators, and we have checked, for example, the premium scanners and the worst scanners that you can find into the market, or low cost. The market now, it's changing, we know from more than 5 years, and the market has changed, and the intraoral scanner has changed. It's in a very big change.
Intraoral scanner, not just a digital implant taking tool now, and people talk more about user experience, efficient to use, and so on.
Maybe 5 years ago we are talking about accuracy, key precision, and all this data. And now all the scanners are very similar, not so similar, but the market it's changing, and now the premium scanners are in a different prices. The low cost are not so low cost, are increasing, and the quality of the intraoral scanners are not so different like 10 years ago, for example. But actually you have a point just into the middle of the market, and they're not between both sides. You have not a big differences. For example, if you compare with premium scanners, the accuracy, it's not so different to this. Maybe you have some possibilities into the software. You know, at the final, this scanner can do this, has these options, for example, the smile design, or has a model creator, or all of these apps, okay, are new into the market, maybe more than 10 years. There are no apps included into the intraoral scanners, only we can talk about the chairside machines that are not thinking into the 3D printers like today. Today you can now, with all of this info, with all of these files, you can manage so fast and mock-up, and you can print in some minutes, and you can test into the mouth. And all of these options 5 years ago was impossible to believe on that so faster. Yeah, just the scanner, just to take an impression. For this reason, now from the first step, from the first day, we can take not some impressions, pictures. We can integrate with a lot of softwares, and we can do some segmentations, and we can show to the patient a lot of possibilities, a lot of problems, and they can integrate, and they can understand perfectly which is the problem, the solutions. And we have all of these tools only in one hardware. We don't need we don't need a big setup here to do all of this, and in one appointment. And this is fantastic.
Yes. So I summarize shortly. What you say is that now compared to 5 years ago, intraoral scanner not just a digital impression tool. People care more about easy to scan, efficient to scan, more patient engagement tools, and efficient workflow from scan to cadcam workflow, or from scan to printing, or from scan to the integration with the smile designs of tools, and so on.
And I think that, for example, one thing very important when you work with these tools, like you can work so fast with this technology, and you can be you can become a better dentist, with this technology, because you are scanning at the same time that you are preparing, and you can evaluate your preparations. You can evaluate, and you can do a better work, and not only workflow, and a better work directly into the mouth with digital technology. It's mandatory to take a tool like this in our right hand in our office.
So how do you see the trend that is going on with intraoral scanner, or let's say the trend with intraoral scanner in the near future?
In the future?
Yeah, in the future. For example, from this year to the next 3 to 5 years.
Yes, for the 5 years maybe. The world is crazy with artificial intelligence, and I think all the softwares include an artificial intelligence. Maybe we will lose some characteristics with all of this integration, but can improve the workflow, can be faster, maybe not so precise like a digital expert can design, can analyze, but can do in 5 years in a very interesting works, very interesting designs, and all of these apps can work in the same direction with with model creators, with apps, with integrations. I think like in ideas we can see a lot of integration between different hardwares. I think the intraoral scanners has to work and are working in these directions to integrate the CBCT or the articular trackers, the face scanners. All of this technology has to be integrated at the final in the same software. And there are some companies that are working to do this. Alliedstar is working to integrate facial photographs and all of this with the designs and communication with the printers. All of this workflow at the final has to be so close, so precise in 5 years. And I think this is maybe the next goal in intraoral scanners, because I think actually that I don't know if we are in the limit of the accuracy with this technology. I don't know. But when you see that all the premium scanners, the medium scanners or the low cost scanners are working in in some tolerance and they're not so distant from onto the others. Actually, not 2 years ago or 5. Okay? It's totally different. Maybe in 5 years, if I check this video, this is like it's crazy, this conversation. But I think that if it's possible to take some algorithms or parameters to change or to be more precise, more accurate of our scanners with the realistic situations, maybe we are not so far.
And you mean the edentulous cases?
Yes, because maybe
I think this is the challenge for all intraoral scan.
Yes, I think I don't know if with the same technology or integrating another technology in the same handpiece. But if you can do with this handpiece all of this, I think this is crazy, because you don't need a big setup with different tools, different machines, different manufacturers, different technology. You need to integrate all in the same software. And I think you need time only for the industry to go in this direction, to include all of this info in the same software, and you can directly print or mill and test in the mouth of the patient in the same day. And maybe from all of this design you can go faster to send for a precise design, to mill, to print, or to like you prefer. But at the final, all of this workflow has to be with more integration of the different hardwares.
I see in your clinic you have the very old model from CEREC, blue can to OmniCam,
red cam,
and prim scan, and the
ZEREC 1, 2,
and also 3-chip, also other Alliedstar intraoral scanners and other models. So, when is your first time to try the intraoral scanner?
208.
208.
Yes.
So, it's about
with red cam.
15 years. 15 years already.
Yeah.
Wow.
Yeah.
That's
and I remember when I opened my office in 2011 and 2011 I started with red cam. After red cam I started with I remember with blue cam. After this part OmniCam, and in this part with OmniCam I opened for iTero. I remember in 14, 15 I remember with Trios 3. No, 3 2. 3 2 was later, and I always, when I try to use the chairside dentistry, I understand that the world can work with another way. It's not necessary to do like a classic philosophy. Okay, you have another options, and maybe 15 years we need 20 minutes, 30 minutes to prepare this type of we can say veneers, crowns, okay, with ZEREC, and now we have more or less the same time, 8 minutes, 10 minutes to do the same. The scanning it's not photograph, it's in a video, okay. Now with color it's more realistic. You can scan with this, and you can with another software you can modify, you can print, you can design, and you can print or you can mill, and the patient has a final treatment in less than 1 hour. Okay, this is crazy, but with these softwares and hours, 30 years ago, people do the same. Maybe not so faster, but the idea was this, and now it's like a big explosion. And if you remember the last 2 ideas, we suffered a big explosion with intraoral scanners and a big change in accuracy. I think for the user it's easy now. Okay, because if you remember with old ZERECs, people has only a machine in a corner and they don't use. Why? Because it was not easy. The user experience, it's so important at the final, because it has to be an easy machine for everyone, not for a super specialist in ceramics, super prosthodontic dentist. It has to be in a democratic technology, and every dentist can do this.
Yeah. How many cases have you estimated? Maybe you have scanned with intraoral scanner from 2008.
I don't know, but you know, in the last in all of these years, and we do actually every treatments in not maybe 7% digital, but we make some digital free or free digital, okay? Yeah. But the rest and removable cases with removable prosthesis the same are in digital. Actually, maybe 7% we make in digital, okay? We combine with analogic, but 10 years ago, for example, with blue cam, I remember I do every day and smiles in one session. In 3, 4, 5, 6 hours, you can do 6 or 12 veneers, and you can cement, you can design, you can prepare in the same appointment, and this was crazy. Yeah. Maybe now, today, maybe I'm not so younger, but now maybe we do a very similar workflow, but we prepare, we print in a provisional, we place the provisional, we design, we do some mock-ups, different mock-ups with adhesive applications, and we can do the cementation the same week or 1 week. Yeah. And the same, this is crazy, on a very high level of dentistry and very fast. This is actually the patients want this. Maybe faster you could. They want only one appointment, 2 appointments, and with digital tools you can do. You only need 2 appointments. One to register, and the other at the final you can place this. Okay. In 2-3 appointments you have a full mouth reconstruction. If you need with implants, maybe 4 appointments. But it's crazy. All of this thanks to the technology. Yeah. Okay.
So what are the suggestions you can give to those beginners with an intraoral scanner on the implant scan, and also even some more challenging cases?
I think now we can explain that you need to work now as soon as possible with a digital technology, with an intraoral scanner. Yeah. You cannot wait another 1 year, 2 years more. You have to start as soon as possible, and you have to select a good tool. And a good tool, it's maybe has to be easy to use. Yeah. You don't need a lot of possibilities when you start with digital technology with a lot of applications. Okay. To be honest, when you start, you want to start with an easy tool. The experience of this dentist has to be perfect. Has to be. You have to take the sense, or you have to feel that the scanning doesn't stop. Okay, you need a correct technique, but now this learning curve, it's not so high like some years ago. Okay, now it's plain. With not many cases you can scan perfectly. And with some tips and tricks you can scan with the same plane. And if you take a good technique from the starting, you need a scanner who come back when it loose. Okay, the scanner has to come back, has to be easy. The aspect of the software has to be easy, and the button to the upper, to the lower, to include the scan bodies or not, to copy the anatomy. 5, 6 options, not more. You don't need more for this. And with some tips, it's very, very easy to scan with all of this technology. For the dentist, I think the color, maybe today you have a good color, the patient can understand perfectly with these scanners. The experienced user, it's easy, it's faster. You know, actually the dentist, when start with this, with scan bodies, you will not suffer problems with this, because you can scan metal frameworks, you can scan metal crowns, you can scan with saliva. Okay, you can select some options to avoid problems with the scanning. Okay, all of these aspects, all of these tools are included into the software. You don't need to suffer with all of these problems. Into the past 5 years ago, or not so 5 years, 2 years ago. Okay, we have not all of these options. But now it's very, very easy to do a good scanner. With saliva, with blood, with the lips. It's unnecessary to use a lips detector. Okay, you can separate, and the software can cut directly the lip or the tongue. All of these problems that we have when we scan in edentulous cases or in partial cases, we always scan all the mouth because it's so fast. That, okay, I remember, for example, 10 years ago with Bluecam, we only scan in half of the arch, not full arch cases. Why? Because it was crazy.
It's like photography.
Yeah.
Video
you
scanning.
need to splint, okay, and to do the union of all of these photographs. And we suffer some stitching with photographs. With the starting of the color scan is the same. Now, not the software corrects automatically, and a big part of these problems. For this reason, now we have better solutions, easy solutions. And when a young dentist, or not so young, experienced dentist or senior dentist start with this, I think it's in a very similar profile. Because at the final, you don't you don't want to suffer problems with the complications with the applications and a lot of characteristics. No, it has to be easy. And I think the facility of use this type of scanners help us to start with this, and we can see every day with our staff. This is young people who starts to help us with a young dentist, and we can appreciate all of these changes with the pass of time in the university, in our postgraduate program. All of the students they check all the scanners, and we can see which scans better, faster, are difficult if the scanner is loose. Some scanners cannot come back so easy. In this case, you don't need to think about this, because the scanner come back so faster than it's not necessary to suffer with all of these old problems.
So, what's your suggestions for those want to start with intraoral scanner and purchasing an intraoral scanner within their budget? For example, $10,000. I think this is a very common budget for a dentist to buy their first intraoral scanner.
Yes, I think that it's a psychological number. Okay. $10,000. Yes, I think for this price, now actually in our office we have scanners than this price or less, and more than 30,
20,
yes. You have many prices. At the final, the experienced users, I can see in our practice and into the university, at the final, the people, dentists, want an easy tool to integrate in the actual workflow, because it's difficult to change the workflow in a practice. For the reason, with this money, you have an option like this, and in this price, around this price, this is one of the most interesting options that you can buy in this price, because if not, you need to go to another budget. But in this price, this is one of the best solutions that you can find to the market. I don't know if in another countries in Chinese market, but in Europe, I'm sure that this is one of the best tools with this price, if not the best, but in the top 5, I'm sure.
So, in your opinion, now easy to scan, efficient to scan, easy to use, now is the top priority for a dentist to choose an intraoral scanner.
We talked about this many times. Yes, this is the experienced user, it's important. Maybe the color realistic, it's important. The apps, every day are more and more important in our practice. But at the final, in all of these products, has to be
seamlessly integrated into the treatment workflow.
And the accuracy, because now manufacturers doesn't say nothing about accuracy. All the manufacturers has a lot of accuracy. The technology has a lot of accuracy. With this, you can do cases like this. You don't need to think about accuracy, because you are working in accuracy. We have many cases. We have a lot of patients every day and many scanners every day to do prosthesis,
Yeah.
and we have this accuracy that you cannot find in every scanners actually.
Regarding accuracy, I know that you have already some research report on different intraoral scanner, different cases, their accuracy comparison. In your opinion, for the accuracy, what are the main factors to achieve a good accuracy? And does the operator's scanning method really matter a lot on achieving a good accuracy with the same scanner?
I think, for example, in implant cases, in implant cases there are many factors. The user's technique, it's very important. The quality, for example, is different to the upper to the lower. There are many studies. For example, Marta Revilla has a lot of publications about these items, and if you have the light or not, the same, you have less accuracy. If the user it's not so experienced like another, at the final it's the technique, the flow into the mouth, if you have more or less stitching, if you have more or less, depends of the scanners. We have another publication in this order with in a different scanners the sequence, to use a sequence, a specific sequence for a specific scanners or generic strategy for the scan. Yes, in some scanners it's important, the strategy. In another scanners not. For example, with these scanners we can scanner with the same strategy with Zerek, with Itero, we can use Trios, and we can use the same strategy with this, and works perfectly. Not in every scanners, but it's important if you have a bad technique, or not so good. This is important. Some parameters like this, but with implants we have many clinical parameters. Not depend of the technology only. The technology have some limitations. There are another technologies like photogrammetry, like for example some parameters to adjust. With metal frameworks are dispositions like Adhesive. This is another technologies, but with intraoral scanners, the final depend of the implant position, implant angulation. If you compensate or not this angulation, this is important. The length of the scan body, you cannot change the length of the scan body. For example, in our office, I use Bioregion scan block and Straumann implants, and in these components, if you want to use with official workflow, the company designing a specific transfer or a specific workflow. You cannot come out of this workflow, and many manufacturers have some problems into the design of these components. Into the scan bodies. This is, we can talk more about this, but the scan bodies, the length, the design, the accuracy of these scan bodies, this is important. The length of the scan bodies, the position, if you have a plane, occlusal plane, for example, the positions of the implant respect to this plane. For the intraoral scanner, this is critical. And maybe at the final, the ideal solution actually, in 23, maybe it's to design specific or individual scan bodies for every cases of full arch. But if not, all of these angulations, length, positions, the distance from a dentist, it's not the same to scan an all-on-4 with a very with the length, for example, to the first position to the sixth position, than if you use scanning, for example, in a patient with 6 or 8 implants, and you have a short distance between scan bodies. This is better for the scanner.
Have you seen any intraoral scanner that has a very high successful rate on all on X cases, on 4, on 6? Yes. There are one scanner who makes a very high precision, not 20 microns, like say, but now actually there are technology who makes this. That's cool. Who makes this? I think at the final, a lot about intraoral scanners, the sensors, the technology that use, actually
maybe the technology has changed. They don't use triangulation like Zurich 20 years ago.
Yeah.
They mix triangulation with a wave with lasers. The sensors are different. The size of the sensors and lasers are different, and the lens. All of this, the engineers have changed the play at the final. All of these things, I think, can help to improve the accuracy, for example, in full arch cases.
Yeah.
Because at full arch cases, in implants.
Yeah.
Okay. Because at the final, in fixed prosthesis, in teeth with cement restorations, in ortho cases with aligners or braces, at the final, it's not so important. We have a big tolerance. Okay. It's not important 200 microns or 300 microns in a full arch case in ortho, in aligners. But in implants, we cannot be over more than 90 or 100 microns. You have several problems, biomechanical problems, and maybe biological problems, like consequences for a bad connection or not a good accuracy in these implant connections.
Yeah. So I think for tackling such challenging for implant scanning, especially the ORX cases, implant manufacturers maybe can do something that helpful to help intraoral scanner to identify the feature points of the scan body. Well, there's also another way, as you said, is that intraoral scanner manufacturers can try to adopt, let's say, artificial intelligences to help achieve a better result than within 100 microns.
Yeah.
Yeah, and another way is for sure is that the technology advancement in different technology passes. For example, confocal, the structured light, which the two are the mainstream intraoral scanner technology. So they can do this advancement, and then maybe in the next 1 or 2 years, maybe there are some more intraoral scanners can do the full arch cases. Implant cases. So thank you for the talks, and really appreciate it to share your experience with Alliedstar intraoral scanner, your in-depth insights on the intraoral scanner industry. And we hope to see more and more your shares about intraoral scanner, because in my opinion, you are one of the really expert on intraoral scanner.
Thank you so much. You're welcome.
And
thank you, Cross, always to give me the possibility to collaborate with you to check the products. I'm very happy with this.